Welcome to ETMC TV and this informative presentation by Stephen Potter, MD. Dr. Potter will discuss kidney transplants. Thank you for choosing ETMC TV.
People from any walk of life can be struck down by kidney disease. Patients with diabetes form the most common group of people who need transplantation. Transplants are also necessary for people with certain congenital anomalies of their kidneys. The general symptoms would be fluid overload, tiredness, poor appetite. As kidney disease gets more advanced, patients often feel like they have a metallic taste in their mouth. Their food often just doesn't taste right to them. And the dominant thing is they just feel weak. What we're seeing nationwide is an aging of the population of people who are entering into kidney failure and needing transplants, and the average age of patients who are getting transplanted is going up. There are about 93,000 people in the United States waiting for a kidney right now. It's too many people, and what we would like to do is over time decrease the number of people waiting for transplants. The way to do that would be to identify people with kidney disease earlier, because if it's properly managed, some patients with kidney disease will never need a transplant. And of course, we'd like to really increase the number of living donors so that we can get some of those people that are waiting off the list and get them transplanted. Ideally, we want everyone to have a living donor kidney. Well, if you have a living donor, then you bypass that whole system. You bypass that waiting list. And the reason that's so beneficial is that waiting time on dialysis is a negative prognostic indicator. In other words, the longer you're on dialysis, the worse shape you're in, and the worse you do ultimately. So the earlier you get transplanted, the more benefit you gain from the transplant. Unfortunately, they often don't know until it's too late. They show up sometimes in the emergency room with fulminant kidney failure and have to be started emergently on dialysis. Dialysis is very difficult. It's difficult physiologically. It's very hard on your body. It's difficult in terms of your quality of life because you're spending 4 hours at a time, 3 days a week stuck in the dialysis unit. Some patients, about 8% of patients in East Texas, are able to do dialysis at home utilizing a technique called peritoneal dialysis, but that's still very challenging. Kidney transplantation is the gold standard treatment for renal failure. It can add years to your life, and it can markedly improve the quality of your life. If you get a living donor kidney, it's very straightforward. You go home post-operative day number 3 or 4. Everything is centered around the safety of the donor. That's the most important concern for everyone involved, including the recipient, who's often very worried about their donor, of course. And so the donor has to go through a whole series of medical tests, including checking blood pressure, looking for early changes suggestive of diabetes. We look for anomalies of the kidneys. We look for problems with their heart or their blood vessels to make sure, as much as humanly possible, that it's absolutely as safe as possible for them to donate. They have to have a compatible blood type. Once all that's taken care of, we do cross matches to make sure that donor and recipient are compatible. But it's very rare for a donor who has a compatible blood type to have a positive cross match. The thing that's really revolutionized the treatment of kidney cancer over the last 15 years is the development of laparoscopic surgery, because it allows patients to get an operation with small incisions. They're in the hospital for a very brief duration of time, and they have so much less post-operative pain, and they get back to their normal lives very quickly. For deceased donor kidneys, there's more variability because we have this unknown of, how long has the kidney been out of the donor's body, and how long is it going to take for the kidney to sort of wake up and start doing its normal activity. So our average length of stay for our deceased donor recipients is about 5.5 to 6 days. Medications are needed for the life of the kidney to prevent rejection. So the patients often are able to eliminate a whole series of medicines that they needed to stay alive when they had kidney failure, but then in turn they have to take more medicine, different medicine, to prevent rejection of their new kidney and to prevent certain types of infections. Kidney transplantation can add a lot of years to your life depending on how old you are. The difference in terms of quality of life is equally profound. It's just harder to sort of document. But when you see patients who are now free from needing dialysis, they can travel, they can go on vacations, they can spend time with family, it just really is remarkable.
Dr. Stephen Potter is a transplant surgeon in Tyler.
Well, I did my medical school training at University of California in Los Angeles. I did my residency in surgery and in urology at the Johns Hopkins Hospital in Baltimore, Maryland. I then joined the faculty at Johns Hopkins Hospital. I did my solid organ transplant fellowship at the University of Cincinnati, and I did an additional fellowship in pancreas transplantation at the University of Minnesota.